This family is doing what you're supposed to do. They're giving their baby the vaccine that protects against pertussis.
Whooping cough is bad, and you can die from it, and that's why we vaccinate.
Pediatric nurse practitioner Patsy Stinchfield wants parents to hear that message after the state health department reported a pertussis death for the first time in 6 years. In all, Minnesota saw 25 cases in infants last year with 8 hospitalizations.
We saw very severe disease. They came into the hospital. They stayed for months. They were on life support. That's the part that's really got our attention.
Pertussis is a highly contagious bacterial infection of the lungs that can be especially serious for babies.
In very young infants, they don't have that ability to clear their cough, so they'll just cough and gasp for air.
For that reason, the CDC recommends the pertussis vaccine at 2 months, 4 months, 6 months, 12 to 15 months, kindergarten, and then a booster at 11 or 12 years old. And in recent years, vaccines have become common for pregnant women.
We encourage it for pregnant women in their last trimester, so they're building antibodies in their own body, so then the baby is born with some protection against pertussis.
The vaccine is very effective, although not perfect.
We have some science going on to try to have a better vaccine that'll give us more longer lasting antibodies to it, but we still need people to get vaccinated, because the more of us who are vaccinated, the more we can protect these babies who are too young to have the pertussis vaccine.
Medical providers in the U.S. switched to a new vaccine in the mid-90s, which has fewer side effects, but many in the medical community want a next-generation vaccine that doesn't wear off as quickly. Back to you.